Okay, hi everybody. Not sure how well this is gonna work because the Facebook's changed their live video feed thing since I've done this last, and obviously I'm seeing black pop up on my screen constantly. Not sure what about, but anyways, as promised, I actually made it, and almost on time, just a little later than I wanted. I was gonna do this yesterday, but when I was looking into it, there was just so much good and important information. It was impossible for me to remember it or get it wrote down quick enough or anything else. And the more information I found, the more there was to find. So I'm actually going to do different segments of this, but for now, today, I'm going to at least tell you guys what I found out yesterday as far as the COVID-19 and the TSC patients. As we know, TSC is a multi-system disease, with the most significant disease being morbidity and mortality resulting from lung, brain, and kidney involvement. We're going to stop here. You need to know the medical definitions of those two big M words I just used. According to the National Cancer Institute's webpage, morbidity refers to having a disease or a symptom of a disease. It also refers to medical problems caused by treatment of other problems. Mortality refers to the state of being mortal, or, lack of better wording, means you're destined to die. Again, these are definitions I got from the National Cancer Institute webpage. Not all TSC patients are destined to die by any means, not at all. They're just referring to some of the issues that come up with that. So moving on, the biggest question right this second is, are TSC patients at a particularly higher risk of catching the coronavirus? The answer is no. Thankfully, they are not at a higher risk, no more than anyone else is to catch the COVID-19. Yes, I gotta scroll down because I'm reading, but I wrote it, copied it, and retyped some of it. The TSC LAM patients are not necessarily at a greater risk of developing severe respiratory symptoms, but they could. So nobody's at a greater risk of catching it, but LAM patients could possibly develop more severe respiratory issues. So some of the TSC related conditions, such as, and I'm going to use the acronyms because I can't pronounce a lot of these words, but I'll post them in the comments later. Related conditions such as the LAM, the SEGA, the AML, patients with reduced lung function, patients with medically intractable epilepsy or refractory seizures. Simply put, it's just seizures they can't be controlled by drugs. They are now offered treatment using some mTOR inhibitors. There is two names that were specifically mentioned, and those will also be posted below. But the mTOR inhibitors have immunosuppressant properties and may alter their ability to fight the virus, which is not good, as we know. However, TSC patients who fall into one of the following at-risk groups, sometimes called a higher risk or a vulnerable group, they should try avoiding the COVID-19 infection, and if at all possible, simply because their symptoms might be more severe if they get sick than anybody who doesn't have any problems. The following patients, the TSC patients taking mTOR inhibitors, specifically the two that are listed in the comments, the TSC LAM patients, or patients with reduced lung function. Obviously, COVID attacks our respiratory system. And TSC patients who suffer ongoing seizures or refractory epilepsy. While having LAM, the LAM, doesn't increase the risk of catching the COVID-19. It's likely that the virus poses a greater risk to these patients with significant underlying lung diseases, per se LAM, and those suffering from reduced lung function, as well as those who are taking immune suppressive medications such as the mTOR inhibitors. These particular patients may be at a greater risk of developing severe symptoms if they were to become ill with COVID-19. Although there is currently no disease-specific data, members of the LAM Foundation Scientific Board, including Dr. Frank McCormick, who's an expert in the LAM and TSC, they've developed a tiered guidance recommendation based on the severity of each patient, LAM patient, and that will also be posted below. Please keep in mind the risk profile for individual patients varies depending upon so many factors: their underlying health conditions, their overall health status, significant impairment in lung diffusion capacity. All LAM patients should pay close attention to the number of cases within their community. In case of a local spread, LAM patients in the moderate risk category are advised to adopt the same precautions as the high risk category. Until COVID-19 outbreak passes, TSC and TSC LAM patients who are doing well, you should postpone your appointments or do a remote appointment for any regular health visits instead of taking yourself out and risking exposure. At this time, there are no strict guidelines about whether to empirically discontinue mTOR inhibitors as a way to prevent or diminish the likelihood of infection in any TSC patient. Not in the SEGA patients, not in the AML patients, not patients with medically intractable epilepsy, especially not in the TSC LAM patients. The current advice could change from week to week depending on the government's assessment of risk to the U.S. population. The risk assessment goes from low, moderate to severe. And how many people in the general population have already caught the virus and how the virus is affecting people. Every little bit of it can lead to big changes. It is currently not known whether taking an mTOR inhibitor increases the risk of complications from COVID. The TSC LAM experts believe that the question about stopping the mTOR inhibitors is very different for LAM versus almost all other TSC manifestations. With LAM, the patients lose lung function when the mTOR inhibitors are stopped, and that lost function might not be regained, even if the inhibitors were restarted. Given the potential for lung function decline when inhibitors are discontinued, they recommend that LAM patients do not stop taking the mTOR inhibitors as a precautionary measure. Certain circumstances, such as active COVID-19 infection, may necessitate a dose reduction or possible hold order for the inhibitor, but these decisions should be made on an individual basis, closely considering the benefit to risk ratio with your doctor. Based on current CDC statements and the recent influenza outbreaks like H1N1 in 2009, the way they were managed, it's recommended that AML and SEGA patients remain on their mTOR inhibitors unless they or an immediate family member, close contact, get diagnosed with COVID-19. For those patients with underlying condition comorbidities, like the ones I listed earlier, which I didn't list actually, other disorders, you need to discuss all your options with your doctor and carefully assess your benefit to risk ratio. Any patients with SEGA taking the mTOR inhibitors, there is a risk of regrowth associated with stopping your inhibitor. However, if you've been exposed to or you become ill with the COVID-19, your doctor may consider stopping the inhibitor for a short time, at least until you're recovered and there's been appropriate monitoring of the neurological exams, maybe some neuroimaging like MRIs and CT scans. just to check for any declining neurological function or regrowth of your SEGA. Patients with kidney issues. If you're exposed to or become ill with the COVID-19, taking a break from your inhibitor until recovered may offer less risk of rapid disease progression. So definitely talk to your doctor about that. Patients with refractory epilepsy, take care to avoid catching the COVID-19 since infectious diseases and fever are often associated with deterioration or loss of seizure control, despite medication. Patients exposed to the virus, your doctor may consider stopping the inhibitors until you recover with appropriate monitoring of neurological status, seizure frequency, severity, EEGs. If the decision to stop is made, you could be placed on an alternative anti-epileptic drug, just as a bridge until you can restart your inhibitor. For patients using tropical cream inhibitors, you should be able to keep using those as normal. The cream should not increase patient risk of serious symptoms. If you were to catch the COVID-19, you should be fine as far as using your creams. But you might want to stop just in case. That's up to you. It is a cream. There's no higher risk for you with those. As we know, the older you get, the worse the effects of COVID-19 are on you. This is starting at the age of 60. The odds of developing severe COVID-19 infection increases. It's especially dangerous to people over 80. So elderly patients and those with underlying chronic conditions such as diabetes, hypertension, heart or lung issues, you are advised to take additional precautions, including, but not limited to, the 6-foot social distancing, hand washing constantly. Every time you touch something, just wash your hands or sanitize them. It's not that hard. Really, it isn't. Avoid touching your face or anybody else's face, especially after you touch something. Stay in your house. You've got family members. I'm sure they would love to help you. Don't be ashamed to call them and be like, hey, can you run to the store for me because I'm hungry? I know I would do it. I know my kids would do it. So just don't be stubborn and do that. Like I said, because I can't pronounce a lot of the words, I'm going to post more information below, and I will have another video in a couple days. But the main question, are TSC patients at a higher risk of catching the COVID-19? No, their risk is no higher than anybody else's. But if they catch it, the risk of their symptoms becoming more severe, depending on what their underlying issues are, that's a problem. So all you TSC patients out there, take care. Loved ones of TSC patients, take care of them. Everybody else, keep in mind, you don't know if somebody's got TSC or not, or any other issues for that matter. So take care of yourselves to help take care of everybody else. Yes, my nephew, Axel, he is having ongoing seizures. They are not able to be controlled by drugs. So yeah, my Axel, my nephew, he's one of those that if he takes it, could become worse for him. Anyways, sorry the video was not perfect like I wanted, but I did get it out and on time. Will be more. And I really hope this new system Facebook worked. We'll see. Anyways, questions, comments, suggestions, whatever, hit me up in messages or in the comments below. Make sure you share this video and get it out there. I'm really happy to announce that Fight for Axel Facebook page is actually growing to other people that I don't know. So everybody keep sharing it, and your friends are picking up on it, and they're picking up on us, and that's good news. The more warriors we have, the more likely we can succeed. Have a great night.